Hi, I'm Maggie. I'm going to be your nurse today. Can you go ahead and verify your name and date of birth?
Emily 060901.
Okay, so today we're going to be doing the head to toe assessment. So I'll start with your head and work all the way down to your toes, and I'm just going to assess everything and make sure everything's working and moving properly and looks okay. Is that okay with you?
Sure.
And then if any time you have any pain or tenderness, don't be afraid to let me know, okay?
Okay.
So at this time I'm going to perform hand hygiene for 30 seconds. I'm going to provide privacy. And are you comfortable?
Yep.
Awesome. So I'm going to keep you covered up. I'm going to raise the bed to a comfortable working position and raise the opposite side rail. All right. So the client's build, height, and weight is proportionate to the client's age, lifestyle, and health. The client is sitting upright and erect on the side of the bed. The client is clean and well kept. Do you know can you verify your last name?
Romanske.
Where you're at?
House.
The time?
2021.
And the situation.
Head to toe.
Okay, the client is alert and oriented times 4. She is answering the questions appropriately. Okay, how are you feeling today?
Great.
Okay, do you have any pain or anything?
Nope.
Okay, so the client did not come in with any pain. She is happy, smiling, and she is willing to participate with the exam today. Okay, so I'm going to go ahead and start with your hair if that's okay.
Sure.
The hair is evenly distributed throughout the head. It is thin, resilient, smooth, and dry. I'm going to go ahead and look. And look on this side. There are no lesions or infestations noted. Now I'm going to go ahead and move on to your face and skull. So the face is round and the skull is round. The skull is normocephalic and symmetrical. The skin is warm, pink, smooth, and dry. Can you go ahead and blow up your cheeks for me? And stick out your tongue and squint your eyes. Facial movements are symmetrical. Now I'm going to go ahead and move on to your eyes. You look at me, and the sclera is white, smooth, with no lesions. The conjunctiva was pink, smooth, with no lesions. The pupils are black and about a size 5, and they are symmetrical. I'm going to go ahead and shine my light in your eyes. Okay, can you look at the tip of the pin in my ear, and then the tip of the pin in my ear? Okay, pleura. Can you follow the tip of my pin without moving your head? Ocular muscles are intact and eye movements are coordinated. Now I'm going to go ahead and just look at your ears. Ears are symmetrical and aligned with the outer canthus of the eye. Okay, I'm going to go ahead and feel. Is there any pain or tenderness? No. Okay, there's no tenderness or pain noted. They are pink, smooth, and elastic. Sorry, hair in my mouth. Now I'm going to go ahead and look in your ears. Okay, there is no blood, pus. There's no blood, pus, cerumen, or lesions noted. There is no cerumen, blood, pus, or lesions noted. Okay, now I'm going to go ahead and do the hearing test. So I'm just going to have you tell me if you can hear that. And then hear that.
Yeah.
Hearing is intact. I'm going to go ahead and just look at your nose. It is symmetrical with the face and proportionate. It is midline, and it is the same color as the skin on the face. So there is no flaring or discharge. I'm going to go ahead and feel tell me if there is any tenderness or pain, okay?
No.
There is no pain or tenderness over the sinuses or the nose. There are no displacements or masses in the bone or cartilage. Now if you cover one nair and blow. Blow, and then can you do the other side for me? The nairs are patent bilaterally. Now I'm going to go ahead and have you tilt your head back. So the nasal septum is midline. There is no redness, swelling, growths, or discharge noted. Now I'm going to go ahead and move on to your mouth. So the contour of lips is symmetrical. They are pink and smooth. Now I'm going to go ahead and put my gloves on at this time. Okay, so I'll just go ahead and have you open your mouth for me. Buccal mucosa is pink and smooth with no lesions noted. The teeth are intact, and I'll try to smile real big. So the teeth are intact and white. The gums are pink and smooth with no lesions noted. Have you go ahead and stick out your tongue. The tongue is pink, moist, and bumpy. It is rough, and it is midline. Now have you say ah. The uvula is midline and mobile. The oral pharynx is pink, smooth, and no lesions are noted. And the tonsils are grade 1. Okay. Now I'm going to take my gloves off and perform hand hygiene. Okay. Now I'm going to go ahead and move to your neck. So it is pink, warm, smooth, and dry. Now I'll do a full range of movement exercise. So I'll have you put your chin to your chest, back, shoulder, shoulder, and then ear, shoulder to shoulder. Okay, full range of movement noted in the neck. Now I'm going to go ahead and do the strength test. So I'll have you push against my hand, and then I'll do it for shoulders. Okay, so the strength was strong and equal bilaterally. Okay, now I'm going to go ahead and move on to your back. No, I'm not. I'm going to assess your lymph nodes. So, preocular, submental, submandibular, postauricular, occipital, anterior cervical, posterior cervical, deep cervical, and superficial cervical. Okay, there is no tenderness or enlargement noted in the lymph nodes. Now I'm going to go ahead and feel your trachea. Trachea is midline. Now you look that way and the other way. Okay, carotid is 2+, and the rhythm is regular. Now I'm going to go ahead and take a listen. Now I'll have you just hold your breath and look that way and the other way. No bruit sounds noted. Now I'll just move to your hands. The skin is pink, smooth, dry, and warm. Cap refill is less than 3 seconds. Skin trigger is immediate. The nails are clean and well kept. Now I'm going to go ahead and palpate your radial and brachial. So, pulse is equal bilateral and 2+. Now I'll be push against my hands, pull against my hands, and squeeze. Muscle strength is strong and equal bilateral. Now I'm going to have you twist your wrists and bend your elbows. Okay, now I'll have you go across, up, and behind. Across, up, and behind. Full range of motion is noted in the wrist, elbows, and shoulders with no crepitus noted. Okay, now I'm going to move on to your back, if that's okay.
Shoulder.
Actually, one more thing, I'm so sorry. Light touch sensation. So I'll have you hold out your arms and just close your eyes and tell me which arm you feel.
Left, right.
Okay, light touch sensation is intact. Now I am so sorry. I'm going to move on to your back.
That's okay.
Keep it covered up. So the skin is warm, pink, smooth, and dry. Now I'll just have you let me know if there's any tenderness.
Nope.
Okay. No tenderness noted. And the spine is midline with no deviations or deformities. Now I'm going to go ahead and percuss over your kidneys, and I'll just have you tell me if there's any tenderness.
Nope.
Okay, no CVA tenderness is noted. Now I'll have you take a deep breath when you feel my stethoscope move. Okay, breath sounds are cleared to auscultation on the posterior side. Now I'm going to go ahead and move on to your chest. So I'll help you. The chest is pink, warm, smooth, and dry. The overall breathing is quiet, even, and unlabored. Now I'm going to go ahead and listen to some breath sounds. I might have to have you pull your blanket down a little bit if that's okay today. Take a deep breath. Deep breath. Sorry. Okay, breath sounds are clear to auscultation on the anterior side. Now I'm going to go ahead and listen to your heart sounds. So aortic, pulmonary, tricuspid, and mitral. Okay, now I'm going to go ahead and do the same thing with my bell. Aortic, pulmonary, aortic, pulmonary, tricuspid, and mitral. Okay, heart sounds S1 and S2 are noted, and there are no extra heart sounds or murmurs noted. I'm going to go ahead and take your apical pulse for a full minute. So I'll go ahead and start that here. Okay, so the rate is about 70 beats per minute, and the rate is regular with no extra sounds or murmurs. So I'm going to go ahead and help you lay down if that's okay.
Sure.
I'm going to go ahead and move on to your abdomen. So if you pull your shirt up, the skin is intact, symmetrical, and warm. Okay, I'm going to go ahead and listen. Okay, so the abdomen is normal active in all 4 quadrants. Okay, now I'm going to go ahead and listen to one more sound. Okay, no brewy sounds are noted. So now I'm just going to go ahead and palpate, and I'm just going to have you tell me if there's any tenderness, okay? No tenderness or muscle guarding noted. Do you have any history of urinary retention?
No.
Okay, so I'm going to defer palpating the bladder at this time. Now I'm going to go ahead and move to your lower extremities if that's okay. So I'll just have you sit up. I'll help you. Okay. So the nails, or the skin is warm pink, smooth, and dry. The nails are clean and well kept. Cap refill is less than 3 seconds. Skin trigger is immediate. There is no edema noted. Okay, now I'm going to go ahead and assess for pulses. Do the popliteal, posterior tibial, pedis pulse. Okay, so the pulses are equal bilateral and 2 plus regular. Now I'm just gonna have you push your feet against my hands, and then push up, and then I'll just have you put your feet down and raise your knees. Okay, the strength is strong and equal bilaterally. Now I'm gonna go ahead and do the full range of motion. So if you pull this leg up, over, in, and down, and then the same thing with this one. And I'll have you extend your knee out, and the other knee, and I'll have you just twist your ankles. Full range of motion noted in the knees, ankles, and hips. Now I'll just have you close your eyes and tell me which leg you feel my touch. Okay, light touch sensation intact. Now I'm going to lower the bed and the side rail, and I'll have you just stand up and walk for me. Okay, and then come on back. So the gait is steady and balanced. Now I'm going to go ahead and leave my patient with a call light and lower the bed all the way down before I leave and make sure she's comfortable and covered up. Okay, that completes my head to toe.